What are fatigue assessment scales for cancer fatigue? Imagine feeling exhausted even after a full night's sleep, and that fatigue just doesn't seem to go away. For people living with cancer, especially breast cancer, this kind of persistent tiredness can be overwhelming. To better understand and manage this fatigue, healthcare providers use specific tools called fatigue assessment scales. These scales are standardized questionnaires that help measure how severe the fatigue is, how it affects daily life, and what aspects of well-being are impacted. One of the most common tools is the FACEIT Fatigue Scale. It has 13 questions that ask patients to rate their feelings of tiredness and how it influences their ability to do everyday activities. This scale was designed specifically for cancer patients, including those undergoing treatments like chemotherapy or radiation, and even survivors. Because it is validated and reliable, it helps doctors track changes in fatigue over time and decide on the best ways to support their patients. Another widely used scale is the European Organization for Research and Treatment of Cancer Quality of Life Questionnaire, or EIRC-QLQC30. It includes a section dedicated to measuring fatigue as part of overall quality of life. This tool is especially popular in clinical trials and research studies involving breast cancer patients, providing a comprehensive view of how fatigue fits into the bigger picture of health and well-being. The Brief Fatigue Inventory is a quick and straightforward tool that asks patients to rate how severe their fatigue is and how much it interferes with daily tasks. Because it is short and easy to use, it's often employed in busy clinics to quickly identify patients who may need more detailed assessment or additional support. The Fatigue Symptom Inventory takes a more detailed approach by looking at how often fatigue occurs, how intense it is, and how it impacts physical, emotional, and mental health. This multidimensional scale provides a full picture of the fatigue experience, which can help tailor personalized management plans. For those who want a thorough evaluation, the Multidimensional Fatigue Symptom Inventory, short form, looks at different types of fatigue, including physical, emotional, and mental fatigue, as well as overall feelings of tiredness. While it takes more time to complete, it offers a deep understanding of the fatigue's many facets, making it useful for research or comprehensive clinical assessments. Sometimes, a simple visual or numeric scale is enough for quick checks. Patients might rate their fatigue on a scale from 0 to 10, with 0 meaning no fatigue and 10 being the worst. These scales are helpful for initial screening or ongoing monitoring, guiding healthcare providers on whether further evaluation or intervention is needed. In the context of breast cancer, fatigue can stem from the disease itself or from treatments like chemotherapy, radiation, or hormonal therapy. Regular assessment using these scales helps healthcare teams understand how fatigue is affecting each person. Starting with quick screening tools can identify those with moderate to severe fatigue. Then, more detailed scales can help pinpoint the specific areas where fatigue impacts life, whether physically, emotionally, or cognitively. Using these assessment tools regularly allows healthcare providers to develop personalized strategies to manage fatigue. This might include adjusting treatments, recommending gentle exercise, nutritional support, or counseling. The goal is to improve quality of life and help patients feel more in control of their symptoms during and after treatment. In summary, fatigue assessment scales are essential tools in cancer care. They range from simple single-question ratings to detailed questionnaires that explore different aspects of fatigue. The most trusted and widely used include the FACEIT Fatigue Scale, the EIRC-QLQC30 Fatigue Subscale, the Brief Fatigue Inventory, and the Multidimensional Fatigue Symptom Inventory. These tools provide valuable insights into how fatigue affects each person and guide healthcare providers in offering the best support possible. Always remember to consult your healthcare team for personalized advice and treatment options tailored to your unique experience.